Good afternoon, everyone.
Good afternoon.
Hello.
Good afternoon. Okay, I believe we have all of the Jail Oversight Board. Lee, is Dave Byrne joining us? Is anyone from GEO joining us?
I believe so. I think they're just dialing in regular conference call.
Okay.
I don't think they're zooming in.
Do we have our solicitors? It doesn't appear that we do. Oh, Shelley. Hi, Shelley. Is Carlton joining us?
He is. We were just on another call.
Okay, I think Carlton may be the last one we're waiting for. Please chime in, team. I think Carlton and Dave Byrne are the only two it seems like we're missing. Shelley, we'll give Carlton one more minute here and then we'll get going.
Okay. Yeah, he definitely is about to call in right now because.
And Lee, if you want to just ping David Byrne and tell him we're starting.
Yeah, I'm calling him now.
Okay. Okay, we're 3 minutes late, so I don't want to. Oh, there's Carlton. Happy New Year, Carlton.
Happy New Year, everyone.
Same to you.
Happy New Year.
All right, let's get rolling. Is everyone ready?
Yes.
All right, host, if you want to count us in at your, as you see fit.
I take it, you mean me?
No, I'm talking to our Always On Air Studios folks.
Oh, okay.
Actually, it looks like we may be hosting this.
Ourselves?
Yeah.
It says live on YouTube, so I don't ever remember seeing that before.
Kevin, Adrian went and changed the post because of the technical difficulties we were having. So I do believe that we're just streaming it.
We
Okay,
might,
is someone going to let us know when we're live? Are we in fact live now?
It says you're live on YouTube. So.
And recording.
Okay, well, if the public is watching, I'm sorry, public, for the oddity of this beginning, but I just want to get confirmation that we are in fact live reporting as we speak here. So does someone actually see the county website and can confirm that we are in fact live streaming.
Joanne is saying we're live.
We are live.
On my other computer, we are live.
I have
Okay.
it. We are live. Yep.
Wonderful. Well, then let's call this meeting to order. Hello, everyone. This is the January Jail Oversight Board meeting. If everyone could please rise for the Pledge of Allegiance. I pledge allegiance to the flag
To
of
the
the
flag
United States of
of the
America
United States of America
and to the
and to
republic
the
for
republic
which it stands,
which
And
one
stands
nation,
one nation,
one
under
nation,
God,
indivisible,
God,
and liberty
indivisible,
and justice for all.
and justice for all.
Thank you, everyone. The first item for business today is public comment. And if the public could bear with us one additional moment here, we just need to check the inbox. And as always, the comments, we have public comment at the beginning and the ending of the meeting. The comment period at the beginning is specifically for items that are on our agenda, and comments at the end can be for anything that you see fit and relevant, with the caveat that if it's inappropriate, we will obviously not be reading it out to the public. And if you can send in your comments, please make sure that you include your name and address so that we can read that into the record. If it does not have your address, we cannot read it into the record. And as I skim through here, we have a few items that we've received. And again, anything that we receive before the end of the meeting, we will read it at the end. And it looks like we have a couple of items, but I don't think that they are items on the agenda, and so we can read them out at the end. But I will say to those who have sent in emails, please make sure that you have in fact included your address. We have a couple that I already see that don't have an address, and so we would need you to email us again and include your address for us to include it in the meeting. If you don't, we will certainly respond to you either way, but we do need your address. And again, the email address to send your comments to is job, as in Jail Oversight Board, at co.delaware.pa.us. All right, unless anyone else sees something that I'm missing, I don't think we have any items that we've received yet that are on the agenda. So moving on to the next item is the approval of the minutes from December. Has everyone received the minutes? Is there a motion to approve the minutes?
I make a motion to approve.
Thank you, Ms. Phillips. Motion, do we have a second?
I'll
Second.
second.
All right. Thank you, Deborah. Motion is second. Any comments or questions? Hearing none. All in favor?
Aye.
Aye.
Any opposed? Okay, the ayes have it. Next item is an approval of the reports from December 2020. Again, is there a motion to approve the report from December?
I'll make the motion.
Thank you, Mr. Lazarus. Is there a second?
Second.
All right. We have a motion and a second. Any questions or comments? Hearing none, all in favor?
Aye.
Aye.
Any opposed? The ayes have it. Next item for today is the appointment of Esker Lee Tatum as the interim warden for the Delaware County Jail. Mr. Lazarus, do you want to give us a little bit of context?
I do. As we know, Donna Millen retired on December 17th after many years of service to the county. Our desire is to, over the long run, is to do a wider recruitment for a permanent warden, but we are very, very fortunate to have working as an assistant warden, Mr. Lee Tatum. I had the opportunity to meet and talk to Lee and found him to be thoughtful, engaging, extremely well qualified. And Lee, I'll let you go through your background and highlight what you think is important. So Mr. Tatum's commitment to us over the coming year does not in any way preclude him from being a very strong and viable candidate in the future for the job on a long-term basis. But within him beats the heart of a true public servant. So he has joined the county as a county staff member and will be our warden throughout the upcoming deprivatization. And for that, we're all very thankful and grateful to have someone of his background and skills and just overall calm demeanor during turbulent times to lead us through the change. So I'll turn that over to Warden Tatum to introduce himself and talk a little bit about what he sees as our challenges.
Well, thank you, Howard, for those kind words. I don't think I've had that many kind words said about me over the last 10 years, but I appreciate that. And I appreciate the opportunity to contribute to this effort. I think that we have a strong cornerstone here to work from. We can build here. Obviously, there are some improvements that are needed at the facility, but I see that some of those things are going to be on the agenda when we transition from privatization to government control. So I'm here to help in any way that I can. I've been with the in corrections over 25 years, 25 of those in the Bureau of Prisons, and just a year and a half with GEO. And so, I look forward to this challenge and bringing to bear some of the experiences that I've had. Just looking to help the cornerstones that I'll be practicing, that I bring from the Bureau of Prisons and GEO, will be correctional excellence, respect, and integrity. I think if you have those three things, anything else is possible. And so with that said, I appreciate the opportunity to help out. And I'm going to turn it back over to you, Howard.
Thank you. I would also be remiss if we didn't indicate that Mr. Tatum is also a veteran. So I always want to point that out. And really just leave it open to any questions that members of the Oversight Board might have.
I would like to point out one thing, that I really appreciate Donna Mellon, who is a real professional and just one of the best people that I know. And I've known her for a short time, but she's just a great person and a person that I really enjoy working with and would like to continue working with, of course, on her part-time basis. So I really appreciate her. I just wanted to say that publicly.
Right, Donna is working with us as a part-time employee and to provide some administrative support. I just also want to share that the respect between Mr. Tatum and Ms. Mellon is mutual. And Donna's comment during our discussions were that if there's anybody she would like to be more like professionally, it would be Lee Tatum. So we're just thrilled to have him join us.
Any other questions or comments from the board?
If I can add one more thing before I do that. So the ordinance requires that as we look at a permanent replacement, that it comes to this oversight board for the endorsement and approval. And we will have, it is our intent to make sure that there is a subgroup of the jail oversight board involved in this selection process going forward to make sure that the values that we represent on this board of the community are included in our future search. So not losing sight of what the county's administrative code requires, and we are going to follow those rules very strictly.
Howard, can we speak at all to the timeline?
So we are in the process of engaging a recruiter to do a multi-position recruitment for us. The warden is one of those. I'm really trying to push to get that contract before council within the next couple of meetings. Once we do that, then we will start the search. And I don't know how long it takes to find a really talented warden, but we will go through the search. And I would hope we'd have somebody on board by early summer, midsummer. I know that when we talked last, the timing of doing that in conjunction with the deprivatization effort is significant and important. So we'll always keep that in mind as well. But it is important that we get the best fit for us going forward.
And Howard, just, I think you alluded to it there momentarily, but remind us of the report. It's a bit of a fuzzy reporting structure, or I should say unique, not fuzzy, but unique in terms of how the warden position reports, given the existence of the Jail Oversight Board in Delaware County. Can you speak to that a little bit?
Sure. The ordinance is a little bit loose, but generally the warden has a reporting line to the Jail Oversight Board, and the warden has a reporting line to the county executive director as well. And so it is kind of loose, but what I interpret that to mean is that the Jail Oversight Board most certainly has the responsibility to oversee what the warden does from a execution and operations and technical standpoint. And my role is to make sure that the warden is supported, to make sure that the resources are provided, and as a member also of the Jail Oversight Board, participate in the evaluation of the warden's performance.
Great. Board, any other questions, comments, thoughts?
Yeah, this is Joanne. I believe that under the ordinance that the board has to confirm or vote on this, approving the appointment of the warden by the executive director. So I think there needs to be a vote on that.
Yes.
Yep, that's right.
Correct.
With that said, then, would anyone like to make such a motion?
Well, I would like to do it since I brought this to the board. I'd like to make the motion for them to vote on appointing Mr. Tatum as your interim warden.
Is there a second? Sorry, who made the second? Was that? Thank you, Sheriff.
Sure.
Motion and a second. Are there any other questions or comments or thoughts before we carry the motion to a vote?
I just would like to make the discussion, and from the point of being the pain in the neck, but going forward, as this goes forward, I know Donna was retiring, and we were fortunate to have someone that could step in. I would really appreciate that the board stay out front on all this, as you just have described, Kevin, and that it's somewhat awkward to present a candidate when we have to vote on it. So I would please request that we really stay out in front of this, and I do see it as a responsibility of the board that I take really seriously, as we all do. So that's my only discussion on this, but I'm supportive of this this hire, and I'm really glad that we have Lee on board.
Certainly. Yeah, as with the interim appointment, I think we will certainly make sure that there is communication throughout to ensure that folks know how things are progressing. And I just want to add my appreciation, Mr. Tatum, to your service thus far to Delaware County, your willingness to serve in the interim role. And I certainly appreciate your interest and your enthusiasm for being considered for the permanent role. So thank you, sir.
I want to add, though, that this was a set of unusual and unique circumstances. It's not ever my intent to have a board ratify something and after an action's been taken. It's an interim appointment, but given the nature of things that we've all been through over the last several months, it dictated that we took the actions that we did. So there's no discourtesy or disrespect intended, nor is there any intent to not comply with the county's administrative code.
Howard, I've been asked by the public, if you wouldn't mind just speaking up a little bit. I love your use of the standing desk, but I think as you go in and out, sometimes I think
Okay.
I'm having a hard time hearing you.
All right. I understand. I will keep my happy feet in one place.
All right. Any other questions or comments on the motion before us? Hearing none. All in favor of the appointment?
Aye.
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 Are there any opposed? All right. The motion carries. Thank you all. And thank you, Mr. Tatum. The next item is approval of staffing penalties for December 2020. Mr. Tatum, as your first task as a formerly interim warden, can you walk us through what the penalties are for December?
Well, for December, there were $202,890.67 in penalties. The staffing rate at 95%, but the effective staffing rate is really at 84 when you consider all the people who are on certain types of leave status. Now that number is up significantly from the previous month, which was I think around 111,000.
Yeah, can you speak to why that's such a jump? I don't remember us ever being over 100,000. So to be over 200,000 is, while it does mean, a discount on our payments to GEO, it's certainly a concerning item.
Certainly. I think it's a combination of things. I think that we've had quite a few people out on certain statuses. For instance, FMLA, that type of leave. We've had more people out due to COVID from November through December. We've had up to 42 staff members throughout that period of time who have been out on some status regarding COVID. I will just chalk it up to that at this point. I think we need more of a baseline to see if this is a trend that is going to maintain itself or is it going to wane. I believe it's going to wane over the next couple of months. I think we've had a few staff members come back already that were unanticipated. To this point, we've had 35 staff members of the 42 return to work. So, and that was toward the end of December. So we should see a difference, hopefully in next month's stats.
Lee, this is Deb. Can I just get clarification? You said a 95% number and then you said an 89, but the
84.
95, 87. The 95 reflects positions that were staff. So 5% of, am I understanding this? 5% of the positions, the spots were left unfilled, even though we had 89% of the folks out for some reason. The rest was in overtime and extra days.
Right. All right. Well, the 95% is based on the contracted number of employees that we're supposed to have here.
Right.
And we have always tried to get to the 100%.
Of course.
But you rarely do achieve that. You always have some sort of turnover.
Right.
All right. But that 84%, which is the effective rate, really is the true number of people actually bodies coming to work. So okay. 95% is on paper.
Yep.
Right. 84% is what we're actually working with. And that number is low. That's why you have the high penalty rate.
So pardon me for re-asking this question. So does that mean that on a given shift, 5% of the positions were unfilled, or does it mean that 16 of the positions were unfilled?
No. What that means is there's a difference between the posts that are required to be covered and the roster of people that you have to cover it. So right. You're always going to have more than that number that you need, right? And so the post is really what you're penalizing when you don't cover a post.
Right.
And so what you're saying is that those number of posts were vacant throughout the month. X number of posts per X number of dollars per hour for that particular job.
But that X number was the 95 to 100, not the 84 to 100.
No, that number that you need, right? And so the post is really what you, right. The post is what you need to cover. And if you don't cover the post, that's what you're paying the penalty on. Not necessarily whether you're at 100% or 95% or whatever.
Inspiring shows.
If you're at 75%, but you covered all the posts, you wouldn't be penalized. All right.
Thank you.
Mhm.
Lee, is there anyone from Geo that's actually on the call?
No, not that I see. I haven't been able to reach anyone.
Okay, yeah, I know that Mr. Byrne is almost always on these, and I would certainly appreciate if you would continue to join.
I will.
Because I know that you're, when you use the pronouns we, while you used to formerly be an employee of Geo, you are no longer. You are now an employee of the county, and as it relates to staffing, as we've discussed many times previously, the county doesn't really have any direct control over what Geo does with regard to staffing. Our only way we have of any involvement on it is receiving staffing penalties when they fall short of the plan. So I would like for our manager to be able to continue to speak to what's going on and what their intentions are to ensure that we have a fully staffed jail, which is something we've basically never had.
Absolutely.
Are there any other questions or comments from the board as it relates to staffing penalties? Hearing none, is there a motion to approve the staffing penalty for December?
I'll make a motion to approve staffing penalty.
Thank you, Mr. King. Is there a second?
I second.
Thank you. I'm not sure who that came from, whether it was.
It was Deb.
Okay, thanks, Deborah. Motion is second. Questions or comments? Hearing none, all in favor?
Aye.
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 Any opposed? Okay, the motion carries. All right, the next item for today is an update on our efforts to contain the coronavirus. Mr. Tatum?
Yes. All right. Well, as of the sometime last week, we were appointed a point of distribution site for the Moderna vaccine. We should be having our healthcare professionals trained for distribution within the next 2 to 3 weeks. Also, there's going to be some training for administrators, health professionals, and other volunteers regarding the distribution of the vaccine on the 14th from 9 to 11. We'll be doing that via Zoom. And so I'll be participating in that as well as others here at the site. As a point of interest, you may have seen a leaflet that I had sent to you from the township of
Concord. It was Concord Townships.
Township, yes. All right, and they were actually, it was a memo to businesses telling them about the preparations for distribution of the vaccine among what you would call 1B status personnel, which is correctional workers, will be educators, firefighters, law enforcement, people of that nature, and including in that group, citizens over 75 years of age. So I just thought that was interesting, had it sent out. As of December 31st, we had no known COVID-19 infections among inmates. Since November 13th, where I count that as our second wave, we started a second wave of infections here. Our first wave was back in March through May, but we started our set point there. And during that period of time, from September 13th up till the end of the year, 121 inmates were tested and 25 had infections, right? All of those inmates have been fully recovered by the end of the year. Also, as of December 31st, we had 6 staff members out 5 of them were pending test results. 1 of them was actually positive. We had up to, as I said before, from that part in November up until the end, as many as 42 staff members out on some status regarding COVID-19. But as of this point, 35 of them have returned to work.
So just to make sure I got that last point. So how many remain non-return to work, or?
That would be 6 at this point. One was positive and 5 were pending the results of the test.
Got it. Okay.
Yeah.
And I think the appropriate next question would be in terms of testing. So what is the current policy in terms of who gets tested, both on the staffing side and on the inmate side?
All right. Well, when it comes to staffing as first responders, exposure is not enough to disqualify you from coming to work. It's exposure and symptoms. All right. Obviously, anyone who's been exposed, we've all been exposed at some point. But if you were to have everyone who was not exposed or who was exposed not come to work, then we have no one here. So that's why first responders have that qualification, so to speak. In terms of inmates, you may recall back in May of this year, we had a mass testing for the inmate population and all the staff members as well. Since that time, we have tested inmates, maybe over 300 tests since, I want to say, May 27th. And of those tests, I think as many as 60 were positive. All right. And those tests, the reason that those inmates were tested is a combination of things. Either they showed symptoms or they were being prepared for transfer to another facility. All right. And the state requires that anybody who's going to transfer obviously must be tested within the 3-day window of them leaving. All right. So it's really worked out to be a random testing for us because we don't pick who goes. They come up, they're from every part of the state or the county anyway. And it's really worked out pretty good for us in keeping tabs on it. Really from May up until November, we had no infections among inmates. I think, well, no, that's not true. We had 2 infections among inmates in that period of time. Since then, starting, I want to say on November 11th, again, we've had as many as 25 inmates get infected.
And Lee, just because it's a critical part of it, so a test occurs for an inmate if they're being transferred to another facility,
or if they're symptomatic.
Right. Okay.
Now, many of the inmates that may have come up positive who were transfers, they were asymptomatic. It's just the luck of the draw that we tested them based on their transfer status, and then they came up positive.
Okay, and are these policies, I know there were some calls with the Chester County Health Department last month. Does that line of communication remain? Are they still involved in setting policies to keep things under control?
We had a real nice, you were there on the call that day. We had a real nice conversation. They were supportive of what we were doing at the time. As you recall, we were doing half-tier exercises at the time. Then we converted back to quarter tier. To enhance our social distancing as much as possible. They were on board with that. Am I still on?
You are, I think someone might be sharing their screen inadvertently.
Oh, all right.
Looks like it ended. Okay.
So, yeah, but no, they've been there for us. We've agreed that if we would contact each other as necessary. But given the rate that the decline in the rate of infections, they were happy that or at least on board what we were doing.
Okay. Any other questions or comments on the topic from the board? All right. Thank you, Mr. Tatum. The next item for today is an update on our deprivatization. And Howard, do you want to make an introduction here? I think we have a new guest.
I will. I'd like to introduce Majid Alsea, I hope I'm saying that right, from Alta Management, who is our owner's rep. Majid helped us have a kickoff meeting with CGL companies last week, and I'd like him to go through his notes in the report that he's prepared.
Good afternoon, everyone. Let me just pull up the report here.
And Majid, if you wouldn't mind, I think as part of that, some may not be familiar with the idea of an owner's rep, and it might be a good idea just to start as you see it. What is your role as it relates to the deprivatization effort? I think we spoke about it a little bit last month, but perhaps hearing from you, who has been an owner's rep on a number of significant projects in the public sector, might be helpful for the public.
Certainly, Kevin. So Alta Management was founded over 20 years ago. And what we do is we're hired by clients to oversee challenging projects, whether they're involve hiring of an architect and an engineer, construction folks. But we'll take a project from a concept to reality, helping represent the owner day in and day out in making decisions and managing the people that are involved in doing the work. Some of the projects we have managed over the last 30 years almost include the current Fromhold Prison Project in Philadelphia, Criminal Justice Center in Philadelphia, Family Court in Philadelphia, the Judicial Center in Harrisburg, and we were also hired to oversee the design and construction of the Pittsburgh Penguins Arena in Pittsburgh. So we've done some private, some public, some combination of those, and very pleased that Delaware County has asked us to help with deprivatization of the prison. And we see ourselves as an extension of the leadership in Delaware County, working hand in glove to achieve the goals that the county wants to achieve.
If I can add, the owner's rep is authorized to act on behalf of the county. They enforce the contract provisions, make those interpretations, they review work, and then they'll make recommendations as to partial payments or progress payments throughout the course of the work. They are very much entrusted to be our agent and act on behalf of the residents and taxpayers of Delaware County.
Thank you. And as Mr. Lazarus mentioned, we kicked off the project earlier with CGL, the consultant that's assisting with the transition priorities. And we talked to the county about its overall goals. And one of those goals is really to try to reduce the prison population over the long term. The county wants to do enhancements to the facilities to enhance security and take approaches to managing the prison that actually keeps the prison safe and keeps the county population safe. We met with a number of stakeholders, the MIS director, with Interim Warden Donna Mellon, and Warden Tatum. She told me a lot about you. I look forward to getting to know you in the very near future so we can be working together on this. We've been updated on the profile of the prison population. We're getting staffing information. I will be spending some time on collecting data, the data that's needed to put together a financial assessment, and we'll be working closely with the county leadership to take the next steps.
If I could just make one comment, I think as folks hear the idea of the county's hope to reduce the prison population, there may be some confusion about what that means. I think certainly hearing it, through one lens, one might say, well, what does the jail have to really say as it relates to who shows up or doesn't show up at the jail? And they would be right. I mean, that really stands within the purview of the court system and law enforcement. But I think just to put a finer point on what you said, Majid, where the jail really does have a say is what occurs when someone is within the custody of the county. And as we talked about many a time when we speak of a county jail as opposed to a state prison, we're talking about a population that is fairly transient. These aren't folks who are going to be here for a long period of time. I think it's something like 80% of the population is there for 60 days or less. And I don't quote me on that exact figure, but I think it's very close to that. And so, where the jail really does have a say is as it relates to reducing recidivism and preparing someone who is going to be here for such a short period of time, as much as 2 years, but like I said, typically far less. The goal really is to make sure that their experience at the jail, while it's never going to necessarily be a fun one, it should certainly be one that prepares them for life on the outside. And that if they're dealing with addiction issues or mental health issues or issues of holding down a job, that these sorts of things, they get the support that ultimately needs to come from the individual. They need to have a desire to receive help, but that the county give that support, and that if we do so, hopefully that would result in a reduction in recidivism, and then we'd have less people returning back to our custody. And in so doing, that that population reduces over time, which obviously is good for the health of our county. It's good for the health of the individual and their family and their loved ones. And it also, certainly from a perspective of someone who is a steward of the tax budget, it also reduces the burden on the county's taxpayers. Madge, anything else you'd like to say about just the process and what happens from here?
Well, I look forward to meeting the district attorney and the public defender, and also look forward to meeting with the court leadership and the court administrator. As you mentioned, it takes all of the agencies working together to accomplish goals. And we'll be working closely with you to talk about potential programs that can enhance the likelihood of reducing recidivism and kind of a revolving door that happens to a few unfortunate individuals.
All right.
Any other questions?
Yeah, any other questions for Majid or Howard or anyone else?
I just had a comment. I'm just thinking that if Magic can fit it into his schedule, that maybe at some point, if you could touch base with the members of the board by a phone call or something, because everybody brings something a little bit different to the board. We have reentry specialists, we have treatment specialists, we have law enforcement, courts, but it might be helpful for you to hear what individual concerns are about the transition. So
Joanne, I can certainly do that. I appreciate the recommendation. That makes sense to me. If I can, and I'll, Mr. Lazarus will get me the list of people and their contact info, and I'll reach out to them.
Thank you.
Any other questions or comments, team? All right. Well, Majid, thank you so much for your help. We look forward to working with you. And if you don't mind, it would be great to continue to have these updates to the Jail Oversight Board and to the public each month.
I will attend.
Thank you, sir. All right. The next item for today is any other subcommittee reports that we have.
Kevin, I guess I wanted to touch base briefly on the treatment and MAT expansion subcommittee. Just, one of the main reasons that, I came on with the Jail Oversight Board here as an advocate and proponent of treatment at George W. Hill, being that with the amount of inmates that come through there with substance use disorder, it's become, the largest treatment and behavioral health facility in the county. And one of the things that we did from day one was create the subcommittee to expand treatment, different forms, different pathways, met with GO, George W. Hill. I think a year ago we had conference call with the coordinator of MAT and treatment in the state correctional institutions, conference call with corporate from GO. We really worked hand in hand with Crozier and the single county authority, which oversees drug and alcohol services here in Delaware County, put a lot of hard work in to get a grant to expand those services. And quite frankly, it seems like we've really put in our due diligence in the work to do this. And in the midst of this pandemic, while the epidemic's still going on, and the reports of more overdoses, more deaths, and just really seems to be that kind of GEO's dragging their feet as far as moving forward with this from, my observation on my end. And I don't have any updates of what's going on. I know we recently got a report of, what's going on with the Vivitrol program, and that has been in place for quite some time, but we've been talking about expanding that, and we have Crozier on board to do that. The SCA has gotten the funding, and I feel like we're on a bypass with GEO with that. And I don't think it's not fair or right, for the citizens of Delaware County.
Yeah, I will share your frustration. The reality is, in order to get an expansion of the medication-assisted treatment program rolled out, while GEO is our manager, they truly and obviously need to play a leading role in that. I will say that we have had a few meetings with them, and I think there's another one tomorrow to talk through their, I think useful questions about the details of how such a program would look and what the expansion would look like in tandem with the existing Vivitrol program. But I share your desire that it move on a much faster timeframe than it has currently. Anything else on that front, Brian?
Yeah, that was all. Thank you.
Okay. Any other updates from the other subcommittees?
Yes, I have an update.
Yes, Mr. King.
Yes, I did have the pleasure to speak with Superintendent Tatum, and we are going to have a kind of a check-in reentry conference call / Zoom, or it may be a conference call, just to get updated of what's going on. So I just wanted to let the board know that we haven't forgotten this, with the COVID and all of those kind of things. It's been kind of rough with the transition and all of those, it's been kind of rough for a lot of people, inside and out, right? So I just wanted the board to know that I haven't forgotten my responsibility in reference to reentry as a subcommittee member. And Deborah, I didn't forget to call you or text you, and I should have. We're going to have a conference call Thursday, and I will send that information to you, Deborah and Joanne.
Thanks.
And Raheem, I think as it relates to the reentry the reentry coalition, I think we have our next full team meeting a week from today, right?
Right. Yes. So yeah. Yeah. So yeah. That's it. I'll talk to you later about that.
I can also just add that just some information that I haven't even shared with the committee, but through the district attorney and probation and parole, they've obtained a grant to work on focusing for reentry, some kind of services for helping people as they are discharged from the facility. And there's work on that. And we had a brief call yesterday just to talk about how to provide those things that might be helpful, TransPass for people to be able to have some transport for a short amount of time through public transportation, a possible voucher for some food for a little bit of time to keep people on their feet. So I think that's in the works as well. So just to let people know that there are people working on other approaches as well. So I'll get with Mr. King and Ms. Love about that and whatever this committee can do subcommittee can do to help.
Great. Thank you, Ms. Phillips. If nothing else on the subcommittee side, the next item is the Warden's Report. Mr. Tatum.
Okay, so the current population is 1145, and The county male inmates, 1,005, county females 109, transfers are 6, lodgers 25. We have total commitments in December of 355, total discharges in December of 447, and the recidivism rate is holding steady at 63%. It was exactly 63% last time. And as I look over the last year, if I had to average it out, it would be something like 62.2% for the year, which is a 4% increase over the previous year. We had, unfortunately, there's some major incidents in December. We had a young man commit suicide. He's a 20-year-old man. He was found hanging in his cell. He was cut down by responding correctional services staff who immediately started life-saving procedures. Happened so that the medical staff happened to be on the unit at that time and immediately took over from them. And then the EMS personnel pretty much in pretty good time got there and then took over life-saving procedures. But unfortunately, they had to pronounce him a deceased. His family was notified. Then 2 days later, we had a young man, 22, who attempted suicide. Fortunately, the staff got to him in time, resuscitated him, cut him down, did CPR. Again, medical staff responded, took over from the officers. That young man was sent to the hospital, the local hospital. He was stabilized and at some point returned to us, was placed on suicide watch. And then on January 2nd, we had a 57-year-old man who succumbed to stage 4 metastatic cancer. And that was unfortunate that he passed and his family was notified as well. So that was the major incidents during December.
Mr. Tatum, just to pause on that front, I think for the latter, the gentleman who had cancer, my understanding is that his family did have an opportunity to spend some time with him.
Yes.
In the hospital.
He was in the hospital as of December 19th. He actually passed on January 2nd. So there was a bit of time in there that they got to go see him.
Well, I you know, as relates to the suicide and the suicide attempt, I realize that this time of year is always troubling and tough for many individuals, and I also realize that every jail has their issues with attempted suicides and successful suicides. But when we have events of this sort, it obviously brings into vivid detail why the work that we're doing here is so important, and why providing the support that we talk of is so important, because it does, when it's, it all comes down to, giving people the support they need and hopefully getting them to a positive, a better mental state than they might otherwise be. So thank you for delivering the news, as tragic as it is.
I got some updates in some other areas. GTL, we had, in terms of visitation, we had 342 video visits scheduled in December. To date, that brings us to 1,231. And of course, it's still free of charge at this point for the video visitation. It's one of our mitigation efforts, obviously, since we've reduced movement around the institution. Commissary operation remains normal. Thanks to the board, though, we're giving out weekly gift bags to the inmates to try to lessen the emotional impact of our restrictions here. And that's going to continue for the next 90 days.
Lee, can you speak a little bit to that? And just pause on that. I think obviously this has been going on for a long time, and there are restrictions in place on inmates having less time outside their cell than they otherwise would. Can you just give a brief reminder of where we stand on what that means in practice?
Yes. So back during the first wave, I'll go back that far. During the first wave, as I said, from March to May, we had, just like the rest of the country, significant infection rate. It's climbing pretty fast. We We instituted the command center, and all management issues concerning COVID went through the command center. We implemented certain protocols. Of course, we social distance as best we can by restricting movement. We established clean teams to go around and clean out throughout the institution between activities and common areas and in the housing units. We stocked up on PPE, trained staff and inmates on how to use the PPE, and went on a campaign of promoting the use of the mask and gloves. You know, there were any number of protocols established as controlled by the command center. Now, we went to quarter tier exercising, meaning that only a quarter of the inmates in a unit could be out of their cells at any given time. This seemed to be the most effective social distancing for us. It's almost impossible to do that in a jail, but we were able to maintain enough distance between the inmates and staff in order to slow the infection rate. In fact, we slowed the infection rate down so well that we had only 2 infections for a 5-month period. At some point, we went to half-tier exercises, meaning that now we're going to let as many as half the number of inmates in a unit out at one given time. We did that. We were successful for a while, but then in November, we started, just like the rest of the country, with a second wave. We went back to quarter-tier exercises to try to further mitigate the spread of the virus. Again, to this point, we've been successful.
Lee, what is that? So when you're in half tier and when you're in quarter tier, what does that mean in terms of in a 24-hour day? How much time is an inmate able to spend outside their cell?
Well, what that means for us is that we meet the minimum state requirement of 2 hours out a day. Right. Under these circumstances, I was actually looking at something you sent me the other day. It was a court order for Philadelphia prison system, where the court is directing them to be out 45 minutes a day. Right. So we exceed that. And of course, that's the minimum requirement for the state anyway, even without a pandemic. So we're doing okay in that regard.
Okay. Well, it is obviously a balancing act. You know,
Absolutely.
I think we want to keep COVID out of our jail and from spreading, but at the same time, we got to balance that with mental health and
exactly
keeping people from essentially being in solitary confinement. So.
Right. So what we've attempted to do to try to mitigate the emotional stress of it is to try to do programming on a remote basis. We, as you approved the gift bags, we, you know, especially during the holidays, that was a big thing. We have communicated as best we can, as much as possible, sending out memorandums as much as possible. You know, we reinvigorated our efforts with the staff with wearing the PPE, because we had talked about it at our last conference call with the Board of Health. And we went on a campaign to make sure that everybody was wearing their PPE. So we just reinvigorated our efforts because, as you know, everyone was coming to, you know, just like the rest of the country, getting pretty much fatigued with COVID and all of the necessary requirements to try to be safe. So we're still hanging in there. We're still doing fairly well with some luck and some effort by the staff. But fortunately for us, we're going in the right direction, and we're going to try to stay there. We just think that over the next 90 to 120 days is going to be critical. It's going to be probably the roughest period of time during this pandemic. And we just need to keep focused. We keep trying to tell everyone here, whether staff or inmates, that this is, you know, it's not punitive. We don't mean to be mean, but we want everyone to be safe.
Lee, one other question I have, we've had in winters past issues with our heating system.
Yes.
Could you give us an update on where things stand there? I know we
still have problems, but we've been, I think, better prepared to fix them quicker. For instance, just in, I think it was December 27th, we had Unit 4, 2 of their pods went down. We found that it was a short in the motors, And so that was fixed overnight, but we did move the inmates, right? And so our protocols, whenever we have a problem like that, since we have space now, we make use of it and we can move inmates from one pod that the heat's not working to another where it is. So we've made use of that. We've had very few complaints in that regard because we've had that flexibility. We just, over in the records building, we just had a heat exchanger replaced, to the tune of about $8,800. First $7,500 paid for, of course, by Geo. So, we are still having, those same problems. This institution's been around for a while, and much of the infrastructure is beyond its life cycle. But they do a good job here through maintenance in maintaining it. We just replaced the grill system here, 2 grills to the tune of $15,000, right? But it had to be done.
Well, I know that, the facilities analysis is a part of CGL's work, and that, as part of what we're doing over the coming year, understanding what the capital needs are going to be is part of that. But, as we're sort of working through this transition, I want to make sure that, I really don't want to get any more calls of, the heat's down and no one's doing anything about it. I realize things break, but I appreciate your efforts to making sure that that you're made aware as soon as possible, and that we move people around so that they're not left without heat.
Absolutely, and that's our primary protocol now, to make use of the space that we have, and we have, and so everybody's staying warm this winter. In fact, we did have since we're on that part, there is an issue out at our sewage station, so to speak, with our pumps. We have 3 pumps out there. 2 of them at any given time should be working in the wells. Right now, we only have 1. And that's a problem because I've seen this before at another institution where your pump station goes down and then all the sewage backs up into the institution. We can't afford for that to happen. And so steps have already been taken to rebuild one of those pumps. There's one working and there's another one that just has to be replaced. So, I'm communicating that right now to the appropriate folks. It's a substantial cost involved. The rebuild is $6,100 for one of the pumps. The replacement pump is somewhere around $22,000. Right. But that to me is a must-have, because you can't afford to have sewage backing up into the facility. You don't want those headaches. So that is an issue of concern, but we're on that right now. As I said, the grills were replaced. In terms of behavioral health update, if you want to hear that. Do you have any other questions on the maintenance? Okay. All right. So behavioral health, we have 5 people on the waiting list for Norristown State Hospital, 3 of which are going to be transporting there in the near future. Our drug and alcohol liaisons discharged 60 people to inpatient treatment facilities in December. And we had 4 participants. We still have 4 participants in Vivitrol. In December, we had 6 participants complete the program and release early from the program. Really, that's the end of my report, except there is one initiative. Ms. Phillips was kind enough to come yesterday and join us. We had a presentation from this company called Text Behind. It's a company that specializes in processing mail coming into the institution. Right? It seems to be a great company. We have 12 facilities in the Commonwealth of Pennsylvania currently using it now. The institutions that we've reached out to, which has been 4 to this point, swear by it. Obviously, the pluses for us in considering them is that there's no cost to the facility. Actually, and if friends and family participate in the program, it reduces the amount of money and resources they need to send stuff into their loved ones. And of course, it reduces the likelihood of contraband coming through the mail to zero. So those are all great points. I will put together a packet and send out to the board members and let you take a look at all the data yourself. And then at some point down the road, hopefully we can make a decision on that. But Ms. Phillips, like I said, was there and got a look at it, and we appreciated her being there. And that's something I intend on doing, is inviting you to the institution as much as possible when we have initiatives. Also, I'd like to reach out to stakeholders in the community and build a relationship with them. So as Mr. Majid said, to get everybody on board, and if we're all rowing in the same direction, we improve our possibility of accomplishing great things. And that's all I have.
Thank you, Lee. Any other questions or comments from the board for Mr. Tatum? All right. We are now, it's not on the agenda, but we are now at our point on the agenda for our second public comment point for things that are not necessarily on the agenda. And I see two emails from Colleen O'Connor, 46-5 Revere Road, Drexel Hill, PA. And Ms. O'Connor's first question is, I understand inmates have a legal right to use the law library to investigate their cases. The library has been closed for months due to COVID. Is it possible for the computers there to be wiped down with disinfectant so the inmates would have this legal right available to them? Mr. Tatum, are you able to speak to Ms. O'Connor's concern at all?
Oh, yes, we've reduced the amount of movement around the institution necessarily so to reduce the spread of this virus. However, it shouldn't preclude us from getting the materials that her son, or I'm not sure what the relationship is, but we should be able to supply the necessary materials to the loved ones remotely, right? And that just takes coordination with his case manager. I would invite her to give me the information regarding her loved one, and I will reach out to his case manager and make sure that happens.
Okay, thank you. And then the second item from Ms. O'Connor is there something that can be done so the inmates can get some fresh air? My son had unfortunately been there since October and has not yet been outside. They don't even open the doors for fresh air to circulate in the prison. Can you speak to that?
Yes. Again, we allow as many as a quarter of the inmates at any given time out onto the units. There's no real outdoor recreation here, so to speak. There is a recreational area that has screens. So you're actually, you can look out and there is fresh air that comes into that recreational area. Now, we will allow some at times when the temperatures permit to open that door and allow those people out if they want to go out. Certainly, I'll look into that and make sure that we're all on the same page with it.
So just so I'm clear, the cell blocks, they all, I've seen them, and they all have that rec area.
One rec area, right?
Yeah. Are you saying that currently, while it's colder, are inmates allowed to go out into that rec area during their time out of their cells?
At the time out of the cells, and if they choose to go out there, and staff permitting, that is, we have enough people to be out there so that we know what's going on, we will allow that. But I don't know of too many people wanting to go out right now anyway. But certainly I will check into that and make sure that we are maximizing those opportunities as much as possible.
Okay, thank you. And that's all I have. I don't know if anyone else who has access to the JOB inbox sees anything else, but that's all I see. All right. Lastly, anything else from members of the Jail Oversight Board before we adjourn for today? Okay, thank you. Is there a motion to adjourn?
I make a motion for adjournment.
Second.
Second.
Deborah, thank you, Judge Brennan. Motion is second. All in favor?
Aye.
Aye.
Any opposed? All right. Thank you, everyone. Stay safe, and we will see you next month.
Thank you.